Well, the flu is epidemic in this country, and if you haven't had it yet, you probably know someone who has, and it's bad.
Oh, it is bad. In fact, CDC Acting Director Dr. Ann Shuchat called the flu one of the biggest health threats currently facing the U.S. Last week, 1 out of every 14 visits to doctors and clinics were for symptoms of the flu. That is the highest level since the swine flu pandemic back in 2009. As of Friday, the flu had taken the life of 53 children in the United States.
Yeah, it's actually gotten so bad that Peninsula Regional Medical Center is once again reminding members of the community of visitation restrictions. Anyone with a cold, cough, fever, or other flu-like symptoms is asked to remain home and not visit patients. Now, the hospital is also restricting children under the age of 12 from visiting. Now, people with appointments are asked to not bring children under 12 to their appointments unless the appointment is for that child.
Now, one of the fastest places the flu virus is spreading is our schools. In Wicomico County, parents received a letter Friday giving them some guidance on when it's okay to send their child to school. The letter informs parents keep their child at home if they're sick with a fever until the child has been fever-free for 24 hours without the use of medication.
So, what's going on? Why is this flu season so bad?
Now, for some insight on that, we have turned to Olivia Butler. She is the Communicable Disease Program Supervisor with the Wicomico Health Department. Thank you so much for coming in today.
Thank you.
Okay, so question for you. There are several flu strains out there, right?
Correct.
Is there any one in particular that's...
Well, right now we're seeing a influenza A strain. It's H3N2. That's the predominant strain circulating.
Yeah.
And that's the bad one, isn't it? I mean, between A and B?
Well, typically when that's the strain that's circulating, we tend to see more severe flu seasons or flu seasons that start earlier.
And that's why it's so bad this year.
Okay, so there was a report that came out that said our vaccine is like less than 20% effective this time around. So is it just not working?
Well, I think the reports for our flu vaccine right now are still preliminary, but
Okay.
I think based on other years when H3N2 has been the predominant strain, they're expecting something similar to last year, which was about 30%. But looking at reports from other countries that have already had their flu seasons or are more underway, like Australia, I think reported 10%, and Canada 17%. So it wouldn't be surprising if ours is a little bit less than 30.
So speaking of the flu shot, is it too late to get one?
No, it's not. As long as there's flu still circulating in the community, it's not too late. It does take about 2 weeks for your body to get the full protection from it. So the sooner you get it, the sooner you'll have the protection as opposed to waiting.
So even less than 30%, it's still a good idea to go ahead and get it.
Yes.
And go with that. Okay, so we've done this before, but please help us again. The difference between flu symptoms and just a common cold.
Well, with a common cold, it typically starts out with a sore throat you might have for a couple days, and then followed by runny nose, congestion, cough. With a flu, you start out the same with a sore throat, but you'll develop a fever most often, followed by some of those same symptoms, but also headaches, body aches, sometimes nausea, vomiting.
Oh boy, and from what I understand, it's really impacting the elderly and the very young.
Yeah, with this strain of the virus, it typically does cause more severe illness in the very young and the very older, those people that might be in between that have underlying health conditions that put them at risk.
So when should we give it up and go seek medical treatment?
Well, if your symptoms don't start to get better, most of the time some people can tolerate them well at home, just getting rest and fluids. But if your fever is high for several days, or you're somebody that's very young, very old, or with those underlying conditions, you might not want to wait those few days, but just call your doctor to see if you should be seen before then.
So beyond getting the flu shot, are there things that we can be doing on a daily basis to prevent catching the flu?
Yes, washing your hands often and covering your mouth and nose when you're coughing, staying home. If you're sick, disinfecting surfaces that are commonly touched like light switches, doorknobs, phones, remotes, drinking plenty of fluids because that will help keep your immune system working well. And then that way when you get sick, if you're already hydrated, you're not going to run the risk of getting dehydrated when you're sick.
Because that's the first thing they do when you get in the hospital, isn't it? Is to put you on fluids.
Sometimes.
And don't be brave and go to work if you're sick.
Right.
I think
Stay
that's
home.
very important.
We don't want it.
Yeah, because you do not want to spread it to other people.
And if your kids are sick, then also keep them home and not send them to school.
Yeah. All right, Olivia Butler, thank you so much for coming in.
Thank you.
Yeah,
We'll do the elbow bump.
Yeah,
instead
the
of
elbow bump
Yeah.
to keep from
I had to
spreading
learn that one.
germs. Of course, Olivia with the
You're
Wicomico
welcome.
County Health Department.